Great day to talk rehab. Today, I have a really interesting case that I want to share with you. A patient who's had episodes of low back pain, real bad, and then it goes away. He does his home exercises, he works out all the time, because these episodes of real bad back pain, and then it goes away. This has been going on for years. In fact, he had an MRI in 2015 that showed a bulging of the disc, okay? What does that mean? That means that the disc starts to bulge out a little bit, okay? The bulging with a little herniation of the disc. So a couple of years goes by, and his back is real bad. This time he decided to come in for treatment. So he came in for treatment, it's the first time to our office. And he's, again, active guy. And all right, this time he's getting a little leg pain though, not just back pain. Let's do an MRI. Let's see what's going on with that disc. We repeat the MRI. And what do we find? No big change in the MRI. Essentially the same now as it was 3 years ago. However, now he's getting leg pain. Now he's getting sciatica, pain that goes all the way down into his heel, all right? Because the nerve is getting irritated. But the disc is the same. So what happened? Let's take a closer look. The nerve right here is by the disc. However, it's also by the joints, okay? So you have the joints of the spine here. These are the bumps, the back of your spine, all right? You have the joint, you have the nerve right in here, and you have the disc. This didn't change, but this is very irritated. So what happened? It got inflamed. The whole area became inflamed. And how did that inflammation occur? Lifestyle. That's how it occurred. You can decrease your risk for this, a herniated slipped disc is the name for it, by changing your lifestyle. We know that the little tears that occur over here, all right, and cause the disc to ooze out and herniate, those tears develop over time with low-grade chronic inflammation. That is related to your diet, as well as your lifestyle. What does that mean? That means you're eating too much grains, too many omega-6 fatty acids, you're eating too many big meals, and you're eating too much sugar, too many sweets, and you're eating too many refined oils and seed oils, they're called, corn oil, soybean oil, cottonseed oil, canola oil, all very inflammatory. A bag of chips, small bag of chips, 3 tablespoons of corn oil, very pro-inflammatory, not a good choice. So this patient, over the last 3 years, got a little more inflamed, made more irritation around the nerve, but the disc didn't get worse. So how do we treat it? We gave him an anti-inflammatory diet. We told him to go on supplements like NutriDisc, which is great, high concentrations of natural anti-inflammatories. We're going on some traction therapy in the office, give him some core stability exercises in the office. So the rehab is going to help the disc from getting re-irritated, but you got to do those lifestyle changes. So that slipped disc is not just a musculoskeletal condition. It can also be related to biomechanical or biochemical imbalances, chronic low-grade inflammation. That you can treat with your everyday lifestyle. So, check out my videos on an anti-inflammatory diet. Check out my videos on foods that stop the pain. And we're going to be talking more about lifestyle changes so that you can prevent inflammation, which leads to deterioration and degeneration, whether it's the disc, whether it's your brain and Alzheimer's, whether it's your knees and osteoarthritis. It's all the same inflammatory cascade. It's been a great day to talk to you about lifestyle change and how your rehab will be more effective. I'm Dr. DeFabio. Like and share.